I'm Dr. Alistair Webb. I'm a neurologist from Oxford. I'm here on behalf of the European Stroke Organisation for this interview. Today we have with us Professor Valerio Caso from the University of Perugia, who's the current president of the European Stroke Organisation, with Professor Bo Norving from Lund University from Sweden, who's the current chair of the European Stroke Action Plan, and John Barrick from the Stroke Alliance for Europe, patient organisation across Europe for stroke survivors. We're here to hear about the Action Plan for Europe and what it means. So Professor Bo Norving, can you explain what the Action Plan is?
The Action Plan is a continuation of earlier activities that has been done twice, the Helsingborg Declarations. The first one was in 1995, setting targets for stroke services in Europe in 5 domains at that time. The second declaration from Helsingborg came in 2006, setting targets for 10 years ahead, and then the decision was taken to make a third Helsingborg Declaration, and now called the European Stroke Action Plan from ESO and in collaboration with SAFE. So the rationale was that is as pertinent as it was earlier. The situation for stroke is suboptimal in Europe. Half of the patients only are treated in stroke units. There's so much that can be done. Services for stroke is unequal and is insufficient. And also the positioning of stroke when it comes to resources and research is far from the position it should have from the impact of disease. So the action plan was prepared by more than 100 scientists and persons from the patient organization, setting targets to 2030 for stroke care in Europe. The action plan now also includes primary prevention, and it also includes life after stroke, where the Stroke Alliance for Europe played a very important role.
Okay. John, I understand that last year there was the Burden for Stroke in your report. Can you tell us what that showed and what it implies for patients, the need for the action plan?
Well, of course, what it showed was that there's going to be a huge growth in the number of strokes due to largely the ageing of the population, but also the expansion of the population. So we're going to be facing a tsunami of stroke coming through unless we do more in terms of prevention in the first place, and unless we then can begin to start thinking about how we can treat people effectively and efficiently, so that when they do have strokes, they don't have a long-term severe disability. But, you know, looking at the numbers, it's quite clear that there are going to be more strokes, and it's clear that a life saved also needs to be a life that can be lived. So what we've really done in this great collaboration with ESO is try and make sure that a bit more attention is now paid to the care pathway after the stroke has occurred. So we've always been keen on making sure that rehabilitation is looked at, but we're also interested in those issues such as the financial situation of stroke survivors. We're interested in the many things that affect stroke survivors longer term, such as fatigue or pain, which are not things that necessarily come to doctors' prominence or priority in the acute unit. These are things that plague people after they've left hospital. So the addition of the life after stroke domain to that series of domains that was in the Helsingborg Declaration is a very welcome step forward, and it really shows that the whole notion of stroke as potentially a chronic disease is now being taken very seriously. And we are working with ESO to make sure that when this action plan is actually revealed to everybody, we work together with politicians, with decision makers, so that the whole of the action plan is implemented, all areas of it, because all are very important. So that effectively is, you know, the burden of stroke has motivated us, but essentially we're always driven by the fact that stroke shatters lives, and stroke is not given the priority that it should have, given the impact it has on society and on people.
Okay, thank you. And Professor Norman, what are the principal targets of the action plan that we hope to achieve by 2030?
Yep, there are 4 overarching targets, and then there are 31 specified targets from the different domains. And the 4 overarching targets are: absolute number of stroke should be reduced by 10%. And the second one is that 90% of patients should come to a stroke unit as the first destination. The third one is to have national stroke plans. And the fourth one is to have a multi-sectoral involvement to promote healthy lifestyle, decrease air pollution, and all the things that we know belongs to the bigger picture that can affect stroke. So very important 4 overarching targets.
Okay. And Professor Kaza, they sound like very ambitious targets to try and achieve.
Yes.
So how do you think we are going to manage to do that?
This is always the question that we receive, saying you have a wonderful document, you have ambitious goal, but from what to how? So we need to have an implementation strategy. So normally in healthcare you use what? Detection, reduction, detection, reduction, and changing. So first of all, the detection. We have the data from the burden of stroke report. We have surveys about endovascular treatment. We saw there's a great difference between East and Western Europe. So in some countries we will need to maintain the services because we have excellent services, for example, in Austria, in Germany. But what we see, there's a tendency to decrease the services. So when we are at this level, we have to work to maintain this level. When we are at a lower level, we have to understand why there is no investment in stroke. And everybody tells to me, oh, you have ambitious aims, but we need money. I always say it's not the question of money, it's how you spend your money. Because often you see that healthcare resources are not spent in the correct way. Maybe not for evidence-based drugs, so why not spending for setting up a stroke unit, only to control if a patient are swallowing and you already reduce the stroke mortality. So after detecting what is not going well, then we have to contact the national societies, involve them, to say, here we are, together with ESO, make this national plan as written in the action plan, and then we have to measure. Quality registry. We have countries like Sweden, who has an excellent stroke registry. We have the rescue registry in Eastern European country, where we can see 2018 is like this. 2020 there has been some changes, and then we can plan all the action to be done in the future.
Okay. This is clearly going to need quite a lot of political will
Yes.
to achieve. So I mean, what will we see the European Stroke Organisation taking to be able to make an impact on what the politicians ultimately do?
The clue is the national societies. We have more than 30 national stroke societies associated. So it's not probably if we as ESO goes to the politician is not so impactful like the national stroke societies. So we can sign letters together, but it has to be the work of the national, because they know much better what is going on in their countries. We will be like an umbrella to support them by the daily practice.
Okay. And John, I think from this perspective, this is one area where the patient voice is critical. So do you think how much SAFE will have a role in this particular part?
Well, I think it's the most important thing in terms of driving change is actually understanding that politicians and decision makers respond not only to facts and figures, not only to science, but there are other drivers inside the system as well. Whether an issue is known about in public, whether it's got the public eye, whether there are emotional issues around it. We all know that a patient that's not treated well gets much more mileage in the press than a patient that's treated very well. So we need to make sure that the patient voice in every country through the stroke support organisation in that country stands side by side with the ESO member organisations, that we go to the politicians and the decision makers together to actually press this case, because ultimately it's the citizens of that country that are living with the consequences of having their stroke, and we need to make sure that ordinary people are going to be the ones who are going to make sure that the politicians are held to account for the things that they do and the things that they don't.
Okay, thank you. Professor Northern to finish. This is obviously an ambitious programme. It's often taken a lot of work to get a lot of organisations together
Yes.
to achieve a great thing, hopefully. What are your hopes for the prospect of this, of when we look back in 2030, having met the targets we hope to meet?
I'm absolutely sure that this will happen. This will take place, and it needs to take place. This is absolutely achievable. It requires leadership. We have the leadership here, and it's also a change in the mindset that it should not be regarded as costs for the society. This is investments that pay back for the society, and stroke is one of the diseases that gives the most in return. This is achievable. We have the big leaders here from ESO, and we will work hard with this.
Okay, thank you very much.
Thank you.